Nisambula Vinaka, Fiji, and a warm welcome to Speak Your Mind. I'm Louise Kaunisela, and I have my guest today who is joining us, and I'm sure that you'd be really interested in this one. She is the head of the COVID-19 vaccination drive, Dr. Rachel Devi, and she's going to be talking to us everything about COVID-19 as well as the vaccines. A warm welcome to you, Dr. Rachel.
Thanks, Louise. It's a pleasure to be here.
Great. So I know you must have a very busy schedule, but just taking, just looking back at yesterday, we have now locally transmitted cases. There were a total of 22 altogether,
22,
is that
yes,
right?
yes.
And 36 active cases. Okay, so just maybe we shall go through how important it is, why people need to take the precautionary measures, or I could say health-promoting behaviors to stop the spread of COVID-19. I mean, it's here now, so maybe you'd like to highlight on that bit.
Sure, Louise. Yes, that's true. Yesterday evening when we had the press conference, there was a record of 36 active cases, of which 14 are from the border quarantine and 22 from the community. Local
transmission, yes.
So basically, the measures have been very clear, and from our press statements, press conferences that we've been having every day with the Permanent Secretary and the team. So it's so essential, and the measures put in place, such as the lockdowns, and also the like literally saying that when you move, the virus moves. These are some very important things we need to be mindful of.
Yes, just one thing, Dr. Devi. Do you think, a majority of the people are being serious about it? I mean, what are your observations?
Well, from observations, we've seen that a lot has changed.
Yes.
People are now using masks.
Yeah.
There are limitations in movements. There's a limited amount of people moving around the country. But having said that, there is still a minority out there.
Yeah, I should say, yes.
There is a minority out there that we still... I mean, yesterday I was driving home and I saw a bunch of boys outside pounding kava. And obviously that wasn't the place to do it. I mean, we've literally... And there's observations done by a lot of other people as well, like playing volleyball or rugby or somewhere.
And sharing takis,
yeah, exactly.
Little simple things. You know, the thing is, Doctor, I mean, it's the simple things.
Absolutely.
We learned this when we were little, It's just people not wanting to, they don't have a care in the world.
Exactly. So that's important. And within this population, we could be contributing to the spread if there was any contact at any point in time as well. So it's so essential that we literally follow the measures that have been put in place by the ministry and the whole government, I'd say. And that is so essential that our stand that, okay, if you don't have any essential movements to make, please don't move. Yeah. And if you're someone within the family is going shopping, please just send one person and not the whole family.
Right.
And obviously that limits. People have been talking about, how do we restrict 3 people? How do we fit their whole family? So the family doesn't need to move. It just at least needs to be that one person.
Yes, and that one person really needs to be careful.
Exactly. The caution, the masking, and washing of hands, at least for the 20 seconds we're talking about. If not, if you're not able to afford the sanitizers, that's fine. You can wash your hands and do it frequently.
The soap is fine.
Exactly, yeah, absolutely. The soap is fine, and do it for the 20 seconds that we're talking about. And masks, people are talking about it being expensive. Fine, you can even sew it at home. Ministry of Health has even gone out of its way to share to the public through social media platforms on how to make your masks at home. That is so essential.
Right.
So it could literally cost you nothing if you've got some spare materials, but obviously doing it the right way is important as well. We're generally recommending use of 2 to 3 ply. For example, if there's 2 to 3 handkerchiefs.
Okay.
And you should not be able to see through it. Sunlight should not be able to go through it.
Oh, okay.
Those things are important.
Yeah.
And essential, I must say, in that way. And obviously, you don't keep repeatedly wearing the same one over and over again. You've got to wash it daily at least. And so basically, there is an opportunity for individuals to be able to do this at home.
Okay.
And apart from that, if you're going into that open space, because it's become essential, making sure we've got that distance. Like
Yes.
right now, I'm sitting here, you're sitting there. I mean, this is a good space.
Okay.
So we're talking about at least a minimum of 2 meters distance space,
Okay.
and that is essential. And the other important thing is making sure that, for example, if you're in a workspace, people have come through, or you're at home, making sure you wipe down the places that you very frequently use.
Right, like
Yeah,
door
exactly.
handles.
Yeah, exactly.
Every time we use a door handle, like
Absolutely.
everything we frequently use, wipe it down. What disinfectant would be good? Bleach would be fine.
Yeah, I mean,
Maybe dilute it
yeah,
and
exactly.
yeah.
Yeah, and Dettol's, etc. So
Right.
those important things which you can slightly dilute and disinfect down. So
Mm-hmm.
those are so essential because we
Okay.
don't realize how many people walk through the door and use the same doorknob over and over again,
Exactly.
or even the same pen in certain places that people have been talking about, and
Yes.
that. So those things are important in terms of measures, prevention measures.
Okay.
But also the other important aspect there is obviously vaccination as well.
Yes.
We have seen a good number, like we've talked about it earlier. We've got about 10% of Fiji's population already vaccinated, the targeted population.
Yes. I believe you're quite happy with that.
We're happy with that, but obviously there's a lot of work to do still.
Okay.
And as the vaccines come in, we progress, and we would love to get the country vaccinated because we're seeing situations right across the world right now. I mean, we've seen
It's
India.
awful. India is really at
India
the top
is
of
really
the rank now.
really high in terms of number of deaths, number of cases. They've passed 1 million deaths already, and some similar situations even happening in PNG right now.
Yeah, I mean that this reason itself should make the people of Fiji take it seriously.
Absolutely.
I mean, I tell them at home, any outsider, just tell them straight.
Yeah.
You're not welcome at these 14 days. I mean, while we're trying to catch hold of all the infections. But hey, we'll be back shortly on Speak Your Mind, Gold FM, only the classic hit. Welcome back to Speak Your Mind, Gold FM, only the classic hits. I'm Louise Kaunisela. My guest is actually the head of the Family Health Unit and also head of the vaccination drive for COVID-19, Dr. Rachel. Thank you so much for taking out the time, to enlighten our listener as well as our viewers on the delayed coverage on FBC TV News. Now, if you have a question to ask, you can call 3220-906 or 7732-906. So, people of the country, our fellow Fijians, they need to realize the seriousness of, having to follow the proper precautionary measures of COVID-19, as you said, because it has now reached a local transmission. But I believe not community transmission yet. So what is the difference, Doctor?
So a community transmission happens. This is something that Dr. Fong did mention. It would happen when we don't find a link.
Okay.
Where, like a source point we've been talking about.
Okay.
Basically, there is no link to that particular case. And that person, somewhere or the other, picked it up from probably a surface. When traveling on the bus, they probably touched the same place where somebody coughed on or something and the virus got to them. So literally, there is no link to how that individual got the virus.
The virus, I understand. Like the one for the 29-year-old woman from Makoi, they found the origin of how she caught it, which was from her husband.
Yeah.
And then, okay.
Absolutely. So that gives us a link, that gives us a source point in terms of where is the virus coming from. So that link removed that community transmission aspect from there.
Thank God,
So, yes.
We were all waiting with a bated breath yesterday, but even then, it was a record yesterday, 12 new cases.
Yeah. But the good thing to note is these individuals, a lot of them have been within the quarantine facilities.
Yes, most of them.
And that's the beauty of contact tracing. And that's why it's so essential when we talk about contact tracing, that individuals come forth and let us know that, okay, I was in contact. I was at those particular churches or the particular functions.
Just be honest about it.
Just be honest about it.
Yeah.
Because with that honesty, will change a world of, it could make a world of a difference for the country.
Yeah, I mean, you have to have, honor for your
Yeah.
country, do the right thing.
Absolutely.
If you know that you were anywhere there and you haven't presented yourself
Yeah.
yet, or maybe they're feeling a bit scared, or,
Yeah.
it's something new, oh my goodness, But what
Yeah.
can you tell that person, Dr. Devi?
I mean, if you're scared, I'd say don't be, because if you let people know that, okay, I was there, we could contain that virus, because right now, if you haven't turned up or you haven't done even home isolation, strongly recommend people to, especially if there was any linkage to any one of our cases along the way, because look, it's all for the country right now.
True.
Ultimately, it's all for the country.
Yeah.
And for us to be able to contain this virus, we need everybody's buy-in.
Yeah, we need
It's
to
not
work
something
together,
that
for sure.
it's not just something that the ministry will be able to do on its own. We need the whole country. We need every individual out there to be able to contribute to this. So turn up. I mean, call 158. If not, the other thing that every individual could easily do is turn up to one of our screening sites right across the country. We've got a lot of mobile teams in particular hotspot areas. We've got stationary screening sites across the country. If anybody is presenting with any signs and symptoms, not necessarily, it may not be COVID, but if you've got particular signs and symptoms, such as a sore throat, headache, fever, shortness of breath, some congestion in the chest, and fatigue, sometimes even diarrhea, etc. All this, even dry cough. If you've got any of these kind of things, you can turn up to these sites and just get a swab test done with them. You let the staff know that you've got so and so. You can present to them, because the only way we'll be able to contain it and know that someone's infected is by testing them.
Yeah, testing, that's the main one.
Yeah.
So when you do the testing, is that the one with the earbud? I've actually, is that the one?
Yeah, you kind of push it
Like
up
the
your
long,
nose.
extra long one. Well,
Yes.
I actually had it done, and I thought there was nothing wrong with it. I didn't even feel a thing. So, I mean, but the doctor asked me, because I did have a bit of a, chesty cough, so she said, she encouraged me, which was good.
Yeah.
The doctor told me, okay, what about you just have a COVID test? And I said, what?
Yeah.
And then I said, okay,
Yes.
but it's fine. Nothing wrong with having a test done.
Exactly. And if you've got any of these signs and symptoms, please show up to one of these clinics, one of these centers, the screening sites, and get those swab tests done, because it's so important.
Yes.
It's because only then we'll be able to know, okay, there's a COVID case or no, and we'll be able to contain it.
Yeah, man. I mean, we did it before. I know it's a lot worse this year because, it's been regarded as a super spreader, the one that was the funeral in Lautoka. So let's just hope for the best. I mean, I suppose we need to stay calm.
Yes.
Yes. I mean, don't panic. I mean, you can't help but panic sometimes. But yeah, you just, what is your advice,
Yeah,
Doctor?
no, I mean, obviously stay calm, do the necessary measures that the ministry's been talking about, and stay at home.
Yeah.
And when you don't need to move, please don't move unless it's absolutely essential.
Yeah, we need to follow the advice of the Ministry of Health.
Absolutely.
So for the next 14 days, this is what we need to be doing.
14 days definitely could save us a longer period and from containing it. So if we listen to the 14 days, it could definitely help us contain the whole virus from spreading and infecting others as well.
Exactly. So, I mean, COVID-19 is similar to just a normal influenza, isn't it?
It's
the symptoms, I should
signs
say.
and symptoms, yes, are similar, but this is also, it's quite deadly as well in terms of what we've seen across the country.
Yes.
And being mindful, this affects our vulnerable population a lot, like those elderly individuals that we've got and those with comorbid issues such as diabetes, hypertension, cardiac issues, etc.
Asthma.
Yes,
Yeah.
absolutely. So
Don't be selfish.
exactly, those are the population that we really want to protect. I know it's the young, us who usually travel outside and come back home, and we could be spreading it to our family. So right at this point in time, we need to be young citizens of Fiji, need to be responsible individuals to protect our elderly population at home right now.
Yeah.
So that protection starts with us.
Thank you, Dr. Devi. Hope you're enjoying the program. Speak Your Mind on Gold FM, only the classic hits. Look after yourself, mask up, social distancing. We'll be back soon. We're back on Speak Your Mind, Gold FM, only the classic hits. I'm Louise Kaunisella, and my guest is the head of the Family Health Unit and also of the COVID-19 vaccination. Now, we're talking about something really serious here. I know there are people who will be worried and there are people who are not worried, but maybe Dr. Devi, how does the coronavirus, COVID-19, spread?
Yeah, so I think our measures in itself have been talking about it. For example, if I'm infected with it and I'm coughing, I'm symptomatic, I'm coughing, that cough, if I haven't dabbed, like covered during my elbow or haven't had a mask, it goes to the air surface. So that's one of the important means of spread there. So that in itself is there. So if we're distant, obviously that is prevented. And if we're distant and masked, that's also important, obviously. So basically all the measures that we've been talking about literally kind of depict what the spread is like. So basically now we know it's air as well as surface. So if you ever touch surfaces that aren't clean but have the virus and you touch your eyes, your nose, etc., mouth, you're exposing yourself to the virus. So those are the important reasons why we're saying that disinfect your areas. Every time there's a high throughput of like a high threshold of people walking through it or using it, always just clean it up and mask up. And if you're coughing, even more the reason to mask up, even at home, to prevent the spread to other family members as well. So it just COVID is one aspect, but it goes with all the other flu as well. Well, you know that someone's sick at home, all of a sudden everybody's having signs and symptoms of some sore throats, coughs, etc.
So true.
So that's essential to note. And I mean, that's a simple replica of what COVID is like.
Yeah, I mean, it's but the very serious version of when, you get to a stage where you can die. Unlike influenza, we can have hot lemon, Panadol, lie down, and it's.
Yeah, and I mean, that's where I must say, honestly, the vaccinations work wonders as well.
Excellent. So maybe we should talk about the vaccinations now. How is the second lot of Astrazeneca vaccines drive going?
Right, sweet. Yes, so vaccines is important. But one of the things I must tell the general public is that, okay, while vaccine is a solution, it's not the only solution.
Okay.
Like I mentioned, all the other measures that we've been doing, that needs to go alongside. Even if you're vaccinated, you need to still do the necessary do's we've been talking about.
Okay.
That's essential, such as the masking, washing of hands and sanitization, distancing, etc. But yes, so the vaccines right now, we've, I think I mentioned this sometime, that we've already vaccinated about 10% of our population.
Okay.
While that went all right, we finished all our doses that we had in the country. Now we have 24,000 that's come into Fiji last week, Monday, and now we're rolling them out. It's quite targeted in terms of the target population that we're going with. We've got our frontliners that were left, so we were targeting them, and soon we'll be relaying generally whom are we vaccinating with this particular vaccine.
Okay.
But when we talk about vaccines, like I mean, I must rest assure people, okay, what is the vaccine that we've got in the country? I'm hoping people know by now that we've got the Astrazeneca vaccine.
Yes.
And this is a WHO qualified vaccine, like it's under the emergency use listing of WHO. We and the Astrazeneca vaccine itself, there has never been when we brought this vaccine to the country, I must tell you, there's no compromise in terms of development of this vaccine. So if people would love to read more, they can always go to the WHO website.
Yeah.
But having said that, these vaccines have gone through all the necessary clinical trials. Fijians are not guinea pigs. We've brought in a vaccine that has been trialed in other places and tested and proven to be good, effective. And then only then WHO has put it in its essential emergency use listing.
Yes.
And one of the things to note is that these vaccines in itself are 2-dosed vaccines. This AstraZeneca.
Okay.
Meaning, if I give you dose 1 today, between 8 to 12 weeks later, I will give you dose 2. And the principle is simple. I'm wanting to boost your immunity through that vaccination to the maximum possible for this period.
I see.
And with the dose 1, while your immune system builds up to a certain percentage, the dose 2 builds it up even further. And the maximum protection is what we need of individuals right now.
Yes. Maybe does that have something to do with the herd immunity? What is it? And could it play a role in stopping the spread of COVID-19?
So that's a good question. What is herd immunity? Herd immunity is when a good portion of the population are vaccinated.
Okay.
And that population literally protects the rest of the population that is not protected. For example, like in Fiji, we are vaccinating all individuals above 18 above. So there is the younger population that is not vaccinated right now.
Okay.
Now, the older population, 18 above, once we have almost that 95-100% vaccine coverage, that population will protect our younger ones.
Oh, that's nice.
That's how the principles of herd immunity.
Right.
Yes.
So that's something that goes hand in hand with vaccination.
Yes,
so it's
absolutely.
something for the population to look forward to, the world population.
Yeah,
I should
exactly,
say, yeah?
as well. So the greater our percentage vaccination, the greater the protection of the younger population for us, especially because we know that we cannot administer these vaccines in less than 18 years of age. Because of obvious reasons, they haven't trialed out the test safety measures in terms of vaccines for less than 18.
Okay.
But once that's done and it's open to the younger population, we're good to vaccinate them.
Okay.
But in the interim, as adults, as individuals above 18, we need to be responsible individuals for our kids at home,
Yes.
that we vaccinate ourselves to protect our children.
True. Very true.
So
Yeah, so that's herd immunity covered. And just on the vaccines that you've been administering lately. I mean, okay, what about the process? A process of wanting to get a vaccination.
right now, the process in itself of vaccination in Fiji, we've been talking about quite a bit, and I'd love to just reiterate on this, is that we'd encourage everyone to get registered. And that registration process is, there's some few essential things why we need individuals to be registered. Firstly is because it's a 2-dose vaccine, and we'd love to make sure that you get your second dose, because like I mentioned, the second dose is essential. And apart from that, like it's going to be help us to remind you as a person that, okay, your second jab is due so-and-so date. So, I mean, we're all human, we forget our exact dates, but we need to be reminded sometimes, and it's just us reminding everyone that, okay, your jab is due, can you go for your vaccination today? Or like we were intending to do a 3-day prior reminder and on the day reminder.
Excellent.
So that's another essential thing. And also, for example, if I got my first jab here in Suva and for some reason I'm in the Western Division, my records, if it was paper-based, Western Division would never have my paper-based records.
Okay.
But because it's on the system, I could get my second jab in West rather than traveling all the way on the day for my one jab. So basically, you could get your second jab or first jab anywhere in the country, regardless of where your home is. If you're out for work, you could do that.
Yeah.
So at least your second jab, first jab and second jab is when you're up for it. It's ready for the vaccination rollout, etc. You can go to your nearest site for vaccinations.
So there you go on Speak Your Mind, Gold FM, only the classic hits. We'll be back in a moment. Welcome back to Speak Your Mind, Gold FM, only the classic hits. I'm Louise Kaunisela, and I have the head of the Family Health Unit and also head of COVID-19 vaccination, Dr. Rachel Devi. So wonderful that you took out the time to be here with us to, enlighten us and let us know about COVID-19 as well as the vaccinations. Now, maybe you'd like to tell us a little bit about the registration processes for the vaccines.
Yes, sure. So the registration in itself, there's a few. We've been saying that we're using the birth registration number for those who are born in Fiji, So if individuals who are born in Fiji and have not had access or do not have a birth certificate at home, they could always turn up to a health facility, or let everyone know that, okay, you could go to this particular sites to get your birth registration number and register, or we can do the registration for individuals as well. But one of the things we really want to make sure and clear that we don't want people to go out of the way to pay for the $10, $15 to get a birth certificate out. Because where possible, we will help individuals. And right now, we've also got an arrangement with the Birth Stats Marriages Registration Team.
Okay.
That you can just turn up to them with your ID card and just tell them, okay, I am so-and-so, and get your BRN number.
All right. We actually have a caller here on the line, Dr. Devi. Let's just get this call. Good afternoon. This is Speak Your Mind. How may I help you?
Yes, good afternoon, Louisa. My name is David. I'm calling from Nandi, and I'm listening to your program. I'm curious to know when the next vaccination process will be rolling out.
Okay, that's good.
In the Nandi area.
All right, Nandi area. Dr. Devi?
Thank you, sir, for that question. Very good question. And yes, like we mentioned, there's about 24,000 vaccines that are in the country. SUVA has started with targeted population, and Nandi and Lautoka specifically will start in the coming week. We're planning to start on Monday, and I would highly recommend you could watch this space, watch the media, social medias, our Minister of Health web pages, and probably the announcer mentions, etc., to hear where exactly the site is for vaccination, and possibly who the target population will be for this one as well.
Yeah, excellent. So I hope that answers your question, my friend who just called in. So you can call in as well, 3220-906-7732906 if you have a question for Dr. Devi as well. So, yeah, the registration processes, you've made it easier for the public. They can get it free. Yeah. That's really good.
Yeah, and just on with registration, there's other few registrations, 2 registrations specifically that we're talking about as well, is if you've got a citizenship number or a naturalization number, you can use that as well for registration. And if you have any problems in terms of registering yourself using these numbers, please give a call to 158 and they'll help guide you through this process as well. And if there's glitches, we'll help you. We really want to make sure that this is accessible to the whole general public. And having said that, if I can say, if you're using your citizenship number, use the first 5 digits and not the year at the end. Okay. And if you're using your naturalized number, use the 5 numbers that's in the middle. That's important to note, because I know individuals have been trying the whole numbers and all. So those are important things. And watch out for a lot of these communications on our webpage, on our Minister of Health webpage, as well as Facebook and Twitter. And we've also opened up now for permit holders as well. So if you're a permit holder in Fiji, you can also register online as well, using the same vra.digitalfiji.gov.fj. Okay. So that's functioning. And if at any point in time anybody has issues, just please call 158 and we'll help wherever possible.
Yeah. Okay. So, I mean, you are wanting to get as many people vaccinated as possible. So, you know, maybe you can. What about the people who are hesitant? What would you say to them? I mean, you have to be a believer in science, right?
Yeah, that's a good question. What if people are hesitant? I would really question what is the hesitancy there. I know, like one of the things we've mentioned about these vaccines is that it's safe. It protects, and there's already statistics which shows that there's significant reduction, almost 100% reduction in hospitalization of individuals from COVID. That is something that's noted in Europe, especially Scotland and UK.
So what you're saying is that if you do get COVID-19, you won't, you know, die from it, like
exactly.
you know, like what's happening in India now. You know,
it literally reduces your hospitalization by 100%.
Okay, so
you could have just simple signs and symptoms, and then your body will fight the virus off.
Oh, okay.
And then you're better. But if someone at home isn't vaccinated, there is a chance that you could spread it to them, and they could get sick if they're not vaccinated, especially the vulnerable individuals.
Yes.
So that's important that we get our vulnerable population vaccinated first.
Yes.
We need to protect them. That's the ultimate goal of vaccination for us right now. We
Yeah.
need to protect our people.
I mean, the world is in crisis right now. We're living in a pandemic. I mean, the last one was 100 years ago, and this is what 2020, and we never saw this coming, but we must have, because the scientists have obviously been studying the vaccines for
Yeah.
years before, trying to anticipating something like this.
Yeah. So one of the things also to note is, I mean, we're talking about, like you rightfully said, science. I mean, the country initially in the first phase of COVID-19, we contained it through a whole government approach. And we can say, when all we were doing during this period through a team effort, the same thing was happening through the science level right across the world, where all scientists came together to create this one vaccine.
Yes.
That's where records have been broken and vaccines have been developed in such short periods.
Right.
So, but like
Because
I
I
said,
think there have been some questions on the short period, right? But I mean, geez, they've been studying it for a long time. And what about anything else that you would like to highlight on the vaccines? I mean, if you're listening in, you can call 3220-906 or 7732906.
yes, no, in relation to the vaccines, I'd say it's safe. And when it gets close to you, in your cities, in your towns, in your communities, please just go for it, go get it, because we really need all Fijians protected from this virus.
Yes.
Especially from hospitalization and dying on us. That's the last thing we would want any Fijian to go through.
Yeah, just
And
another question. Sorry to butt in there, but I forgot now. Sorry, but we'll have to come back to that on Speak Your Mind, Gold FM, only the classic hits. We're back on Speak Your Mind, Gold FM, only the classic hits, and I'm talking to the head of the Family Health Unit as well as the head of the COVID-19 vaccination drive, Dr. Rachel. Now, you have been telling us how important it is to get our vaccine, so just to protect our nation as well as the world. Now, what are your thoughts? This is coming from a local story that we had on FBC News yesterday on some private doctors in the country turning sick patients and even children away. Is this in the fear of the local transmission of COVID-19, do you think?
I'm not sure why would they be turning away these patients, but they shouldn't be, as an obligation. As doctors and nurses, we take an oath to serve, so that's essential for us. There could be more to it, we don't know, but it's essential that we take care of our people.
So as a doctor, you're definitely not supposed to be doing that, right? Okay, so maybe we go over the highlights of the importance of current health measures.
Yeah.
We are on our last segment now, so I think it's good that we highlight this.
Yes, thank you. So yes, so like I'm been mentioning, I think it's never enough to reiterate even again and again, because it's so essential. We really need people to stay home right now. If you can work from home, work from home. I know essential workers only are allowed to go to workspaces, and mask up, avoid the contacts, stay home, stay safe. Just make sure you're keeping that distance if you're going out into the community to a public space. If you're using a public transport, masking is essential, and ultimately vaccination is essential, and making sure you're cleaning up your surroundings. And like I've mentioned before, if you can't buy a mask, you can make it at home. It doesn't cost a penny if you've got everything at home. You're just probably using old material that's probably lying around from somewhere that you could make it out of, but making sure it's of 2 to 3 ply.
Yeah.
And yeah, so that's important.
Yeah.
But keeping that distance. Remember, when you move, the virus moves with you if you're infected.
Yeah.
And right now, unless we've tested people, we don't know who's got the virus. And you've come in contact with individuals that have tested positive, please self-isolate. If not, call 158 for any further recommendations and get yourself tested.
Yeah.
Those measures are so important. I couldn't emphasize more because right now we need the whole country's approach.
And
It's
support,
every
yes.
individual out there is important.
Yes, that's so true, Dr. Devi. But now the question came back in my mind again, the last one that I forgot. But this one is, side effects of the vaccine. Some people were saying they were feeling, really sick after quite a while after that. But I mean, it's like, well, I suppose comparing it to babies when they get the immunization, they get the fevers and stuff like that. And do you also have people who just cannot take it because of some reason?
Yeah. So yes, side effects. With the side effects, even I got a jab. I had a bit of a fever, a bit of a joint pain, chills and rigors, like shivering at night. But for that, I had to obviously take my paracetamol, hydrate well, and I turned up to work the next day. So these are some of the common side effects. And I mean, if you're a parent out there, you know what your kid goes through when they're vaccinated. And as parents, we've allowed our children to be vaccinated for a purpose because we want to protect them from diseases. And now the same is for us to protect ourselves and our children with the herd immunity concept I shared earlier. So the side effects, it's basically telling us that our body is developing some antibodies.
Okay.
It's building up soldiers to fight off this virus,
Yeah, I
to knock
remember
off this virus.
learning that in school, the white soldiers of the body, right?
Yes. So when that builds up, it basically helps protect you, fight it off, and prevent the disease from getting severe. So those things are important. But if you do not have a side effect, doesn't mean your body is not developing soldiers. Remember, every individual is different. And our bodies, our responses to things are very different. Some kids would probably sleep through after a vaccination and not even feel an itch. But some would probably drive their parents crazy all night.
True.
So it's the similar thing that we could go through, but not necessarily we will go through it. So it's normal. And in terms of contraindications, we currently in Fiji, we're not recommending it for pregnant women. We're keeping it till they deliver.
Okay.
It's okay for women who are breastfeeding. Breastfeeding. That's pretty safe there. So we can vaccinate as soon as you've delivered. That's good to go. And apart from that, if you've, we have turned away. I think I just turned away one person who had really bad allergies to a whole bunch of medicine.
Okay, so that's a risk there.
But otherwise, if you've have taken vaccinations before, no issues of allergies, etc., or you were allergic to some medications, but not everything and anything, because we know some individuals have an allergy to almost every medicine that's out there. So it makes it difficult. But
So for them, maybe you give them other advice or to make their immune system strong, maybe?
For them, basically, the herd immunity concept comes in.
Oh, right. When most of the population is vaccinated, they get protected.
Yes.
Oh, lovely.
Yeah. So that's the important thing. But also now with the measures and even with vaccinations, the 2 jabs so essential.
Okay. It has to be 2. Remember that. So we do
It
have
has to
that.
be 2.
And go to the Ministry of Health page to find out more.
Yes, we've got all the details up there, and please to create awareness, care to reshare.
Okay,
that's important. Care to reshare all the information that we've got, because we've got a few thousands of friends. You probably make up a lot more, thousands and thousands to reach out the whole country.
Very much so.
Because I know we've got connectivity right across the country right now. Some way or the other. So when we share some information, credible information, and get the right information, don't be misinformed by other sites.
Yeah, exactly.
Get the right information from the Ministry of Health, social media pages and sites. And
how about the insensitive people, What do you have to say about that? I mean, Dr. Fong was really upset about that one, wasn't he?
Yeah. So, I mean, I think we all have sisters and brothers and kids around us, and if we wouldn't want others to treat our children differently, right? We would treat them the same way they would treat our children.
Exactly. Well, well, thank you so much, Dr. Devi, again for coming in to speak your mind. And it's over now. So best of luck, and thank you for the good hard work that you're doing with the Ministry of Health, the frontliners and everyone. We wish you the best of luck. And on Speak Your Mind, Gold FM, only the classic hits. Thank you for your good company, and I'll catch up with you again next week.